This year's World AIDS Day theme is Let Communities Lead, placing communities at the forefront of confronting the barriers that are driving the global HIV epidemic further. The national commemoration is taking place at the Ngcedomhlophe Sports Field in Mandeni Local Municipality in KwaZulu-Natal. SABC News reporter Vusi Khumalo is there and he now joins us live. Vusi, good morning once again. Tell us how far we are in the program.
Yes, good morning, Aldrin. Yes, people are slowly trickling into the venue where the World AIDS Day commemoration will be taking place here in Mandeni Local Municipality, northern part of the province or north coast of the province of KwaZulu-Natal. We are expecting the Deputy President of the country, Mr. Paul Mashatile, as well as other dignitaries, including the Premier of the province of KwaZulu-Natal, Nomusa Ngcedomhlophe, as well as her cabinet, including MECs, as well as Health Minister Dr. Joe Pahla, his deputy Dr. Sibongiseni Dlome. All of them are expected to be here to be leading this event, which is celebrated globally. As you know, that worldwide, we are told that the numbers of people who are HIV positive are about 39 million people, with the biggest portion of that being here in South Africa. Almost 8 million people in South Africa are living with HIV. And also, I must say also that having spoken to Petros Khoza, who is from the health department earlier on, he did speak to the fact that South Africa unfortunately has got 1.2 million who are HIV, but unfortunately are not on the treatment or not receiving treatment. And as government, they are trying in their best in order to ensure that those people are being put on treatment, with days such as these being encouraging and also conscientizing the public and those who are HIV positive to also do go to the health facilities such as clinics so that they can be checked. There's quite a number of people, I must say, that who are slowly trickling into this event, and among those is a person or an organization that works or that deals with the issues of gender-based violence. As you know, that gender-based violence is also linked to HIV, because a number of people are also being abused. And with us is Miss Ngcedomhlophe who's going to tell us about the organization that she works for and also what sort of work they are doing in the community, because these are some of the organizations that are at the coalface of driving the barriers and also capping the spread of HIV/AIDS. Mama, just briefly, if you can just tell us about the work that you do and also the name of the organization that you are managing.
Good morning, and thank you so much for giving me this opportunity. My name is Ngcedomhlophe, as Mr. Vusi has said. I am from the organization called the House of Hope and Recovery, which basically deals with the victims of rape and also of domestic violence. So we are doing gender-based violence and femicide. We are strictly based in Mandeni Municipality, also in a Ward 15. That is where the shelter is. Basically in this shelter we are having about 15 women and their children that has been abused, that we shelter and that we give counseling to them. Basically, those are the things that I can say for the introduction.
How prevalent is the abuse of women and children, especially young children, here in Mandeni?
There is quite a number of children and women that has been abused, that really comes to the shelter and also that access services to us. As we are working with different departments, we have really found out that this is now really a pandemic, which tells us clearly that there is a need for the communities to come up and fight gender-based violence and femicide. As we can see that a lot of children are being abused and then there are no parents nearby them. And also we have realized that this pandemic is also affecting men and also women. So we are saying, as the shelter or as the organization, it is really paramount important that we find out the strategy that can really eradicate violence in our societies.
And today's event is being held under the theme "Let Communities Lead." What sort of role that you are playing in terms of capping the spread of HIV? We also know that you are also in some instances, and how do you deal with the patients of HIV, those people who have been abused, that you are sheltering, as we are saying that you have accommodated about 15 people. We know that in some instances there are those who are HIV positive. How do you deal with them?
Yeah, it's a very vague topic, Vusi. To be honest, I'm really happy today because we are here to say, let the communities lead. We honestly have an understanding that if ever the communities honestly can come up and have a word or a say, or maybe a particular strategy whereby the communities are being involved, because we have found out that mostly the programs are being run by the departments. They are the people who really deals with a lot of things of HIV and AIDS. So, but if this can really come down to communities, and we see the communities being involved, being funded, because the challenge that we as the organizations are facing is that we are not having any funds. We run out of passion, and then at the end of the day, if ever you are there trying to assist people, there is no money and there is no one to assist. At the end of the day, we really need money, we really need assistance, we need literacy, especially to cases of HIV and AIDS, because in some of the cases right there at the shelter where we are, we find that people are defaulting. There's a whole lot more of defaulters, and these defaulters comes from domestic violence, because sometimes the perpetrator doesn't want to allow the mother to go and access the medication at the right time. Sometimes we find that some of the children are being infected because of the lack of understanding and the lack of knowledge. So that's why I'm saying it is really going to be good if we find out that there is much of literacy coming to the communities, whereby we see the councils down there being involved. We see the people from the grassroots levels give an understanding of everything that they are really in need of. So we are saying communities honestly can lead. I love this theme that has been given to this event today, that people must be involved, communities must be involved, so that we can find a solution, because the government on its own cannot be able to come down and do the work. But we are there at the grassroots levels. We need to be empowered. And then one of the things that I've just found out is that the challenge is also of power and control. So if there is power and control in the families, then that's where the challenge starts. So then it has to be tried to amalgamate it somehow, and then we find a way of dealing with it. So let me say the theme for today is really covering what we really need as organizations down there at the grassroots levels, either be of the GBVF or also of HIV and AIDS. We need to be taken together, have a way of helping us so that we can work hand in hand.
You are talking about the lack of funds, which is a bit of a disadvantage in terms of you working in the community. One will say that government is also giving grants to NPOs as well as the NGOs that are on the ground. I was saying that perhaps is it not enough?
Truly, it is. We really applaud and we say we salute the government, because they are really helping us, especially the Department of Social Development in our case, as we are doing GBVF, and also the HIV is from health part of it. But it's really not enough. It's not covering our expenses. It's not covering anything. We're really suffering down there at the grassroots level. If ever the government honestly can push something to the grassroots level and have a particular way of maybe helping us so that we can be able to use funds properly, because we sometimes fail to see the need and maybe manipulate some funds somehow. But truly speaking, if ever we are being given literacy, proper literacy of maybe managing everything, then we can be able to do, because we have a passion. We honestly need to see ourselves being empowered so that we can be able to do the work properly.
Sabonga cool that Mamu Lungile and who's also working for or managing a center manager for the organization that houses or shelters the victims of gender-based violence. As you know, that in South Africa there's also this high prevalence of abused women and children, and also being one of the, since we have started on the 25th of November, the day this month, as we are also commemorating the victims of the gender-based violence, 20 days of non-violence against women and children. So she is also playing that role here in the community of Mandeni by ensuring that the victims of gender-based violence are also getting assistance, social assistance, and also are being helped. But she's also touching on the very important aspect of the lack of funds. She's saying that she's running her organization on a shoestring budget that is not enough, that grant is not enough coming from government. But with that said, we know that we are expecting the Deputy President of the country, Paul Mashatile, to come and lead the activities here today, being World AIDS Day today, commemorated here in Mandeni, with South Africa also battling in terms of ensuring that those who are HIV positive are also getting or receiving treatment. So we are going to hear more details as the day unfolds.